I basically wanted to find out how this Mi varnish, which contains 5% sodium fluoride and CPP ACP, and fluoritop, which contains only sodium fluoride, acts in prevention and also remineralization of white spot lesions in orthodontic patients at 28 and 56 days after bonding. The objectives: first one is to determine the effectiveness of Mi varnish containing CPP ACP in preventing white spot lesions at 28 days, 56 days in patients undergoing fixed orthodontic therapy. Next is to determine effectiveness of fluoritop varnish containing sodium fluoride in preventing white spot lesions after 28 days and 56 days in patients undergoing fixed orthodontic therapy. And finally, to compare the effectiveness between Mi varnish and fluoritop in preventing white spot lesions. So the entire study was approved by the ethical committee and permission was clearance was obtained from institutional ethical committee board. The subjects who reported to the Department of Orthodontics who fulfilled the following criteria were recruited for the study. The basic inclusion criteria is age range of 15 to 25, both genders, full complement of permanent dentition excluding third molar, and is class 1 malocclusion with bimaxillary protrusion who requires extraction of both maxillary and mandibular first premolars and no previous history of extraction of fixed orthodontic treatment. The exclusion criteria includes any dental abnormalities like attrition, abrasion, erosion, enamel hypoplasia, enamel fracture, patient who had a habit of smoking, nickel allergy, suspected allergy to milk protein, subjects with systemic illness, growth abnormality and bleeding disorder, subjects with history of trauma or injury to the face. The application protocol of both the products used here is described. One is Mi varnish. For both this varnish application, the tooth should be cleaned, it should be dried before the application, and for both of them the prophylaxis is not required. And once they are applied, they are left and prevent the root resorption, because this is the another common occurring iatrogenic effect of orthodontic treatment. So orthodontically induced inflammatory root resorption is another prevalent iatrogenic complication encountered during orthodontic treatment. While minor resorption is often considered as a normal biological response, severe orthodontically induced inflammatory root resorption is a significant clinical challenge which potentially affects the tooth vitality, the prognosis, also the long-term stability of the orthodontic treatment. The common causes are excessive orthodontic force, improper biomechanical loading and prolonged treatment duration. Also, genetic predisposition may cause the orthodontically induced inflammatory root resorption. So this is the sequence through which the orthodontically induced inflammatory root resorption occurs. Whenever you give an excess force, there occurs ischemia of the blood vessels inside the periodontal ligament, and the necrosis happens within the periodontal ligament, which in turn will induce the osteoclastic activity, thereby causing root resorption. So next thing is, whenever we have open bite in the orthodontic treatment, to reduce the side effects of the orthodontic treatment. One such is minimally invasive surgical techniques, that is corticotomy, piezo-session, micro-osteoperforation, which actually came into the field of orthodontics for reducing the treatment time and accelerating the orthodontic tooth movement. Among this current stage, the micro-osteoperforation is a practical one, minimally invasive and also biologically effective method, where they create a small micro perforation into the alveolar bone, which in turn will trigger the regional accelerated phenomenon and will cause the increased bone turnover and also decrease the resistance of the tooth movement. Root resorption is also influenced by the stress levels and distribution. Therefore, we have to evaluate the mechanical impact of micro osteoperforation. And for this, we need a finite element analysis which provides a sophisticated and non-invasive approach for assessing internal stresses within the dental structures. So what we did a finite element study to assess the impact of micro of 3 mm, 6 mm and 9 mm from the crest of alveolar bone in the interdental space. Once the holes are created, then the geometry is fed into a static structural mechanical editor window for further processing. The tooth segments, alveolar segments and periodontal tissue are constructed. A 1 mm size has been used as a global mesh size to capture all features of the geometry. and at critical zones 0.5 millimeter mesh size has been used. Again, nitric oil springs was connected from the mini screws, you can see here, from the mini screws to the arch wire on the buckle side, and from the mini screws to the palatal button on the palatal side, and all springs have been assigned with a stiffness value of 0.5 Newton per millimeter in longitudinal direction to replicate the actual condition. In addition to this spring, a beam connection was also established with a diameter of 0.3 millimeter to apply pretension values. And into 41,422 nodes. So all bracket screws and wires have been assigned with the stainless steel property. Maxilla has been assigned with the alveolar bone property. Tooth, crown and root portion have been assigned with the dentin property, and periodontal ligament surrounding root portion have been assigned with the periodontal ligament properties. So the entire system has been an analysis which was a non-linear static structural analysis. The symmetrical model was considered. In this analysis, geometrical non-linearity has been considered since it is assumed to be a large strain problem due to highly deforming materials present inside the assembly. And in addition to this, springs deployed appropriate stiffness at the molars. Beam was also employed to apply pretension pulling loads of 2 Newton on the first molar. Pretension load applied on the beam depicts the actual scenario or the physics happens between the screws and the connected tooth. Non-linear analysis have been solved at the minimum increment of 10%. That is, results shall be extracted for every 10% of the loading. The results were analyzed after post-processing. The stresses calculated were represented by colorful bands of different colors of different level of stress. Red column of the spectrum indicates the maximum level of stress, and blue as minimum with colors orange, yellow and green in between. The results are obtained as the distribution of stress in the teeth, in the periodontal ligament and the surrounding alveolar bone after the application of 200 gram of intrusive force by 3 mini implants, 2 of which were placed on the mesial aspect and distal aspect of the buccal surface of first molar, and 1 in the palatal surface between first and second molar connecting the first molars.